Hey guys, welcome back to Medical Coding with Blue. It's finally Friday! So I am going to be shooting Quiz Friday on a separate video, just to keep it organized. This is just going to be a catch-up video right now that I wanted to shoot so that way I can just kind of talk about my day and tell you guys what happened today, because I did one of my favorite things to do, which was a class today. This class has been on the books for about 2 months now, and it all started a few months ago when one of my old providers from the pain clinic contacted me because she couldn't reach her coder, and she was asking me, why would her levels drop if she's spending all this time with her patients. She's heard that her evaluation and management levels have dropped. So what is causing that? And I told her I haven't reviewed your documentation as of late, obviously because I've been pulled out of that clinic, and I got pulled out when we were restructuring the clinics, and this clinic got reassigned to another coder only because this clinic had done so well, and their documentation and all of their code selections were right on target, and everything was good and everything was flowing. So they said, okay, this clinic can basically go on autopilot because it's okay. They know the ins and outs of their documentation and everything is good. So Blue, we need you to go to these other clinics that need your help. And so I was like, okay, I can do that, no big deal. And but it was hard for me when I had to let them go, because even though I know that they were going to be okay, and essentially they were documenting as they were supposed to, it's just still hard for me to kind of release them when I know that it's going to be somebody else that's going to take care of them. So I just sort of like sit back and hope hope for the best. But for whatever reason, this provider could not reach her coder, and so she contacted me and was asking me, what's going on. So I said, okay, well, let me talk with your coder and find out what's happening and what's going on, because there's a myriad of reasons why your level would drop on anything that you're doing. Because if you're not documenting the number of bullets, the appropriate number of bullets for your review of systems or your physical exam, or if maybe there's a part of your PFISH, your past family social history, is missing, that could also be a part of it as well. If you're not documenting your medical decision making properly, that's another reason why your level could potentially drop. And I said, but let me go ahead and contact your coder and find out what's going on. Well, I contacted her, and I found out, that, she was missing part of, the bullets on her review of systems, and then the physical exam was not as strong either. So I said, okay, so clearly we need to do an evaluation and management class, and she says, well, Blue, I get really nervous when I'm around, new people, and I don't really know these people very well. And I said, don't worry, I can help you if you like. I don't want to step on any toes, but I can help you if you like. And so she said, oh, yeah, I would really like that. And I said, okay, well, then we need to get with the clinic administrator and get this set up for one of the training days. And so she's like, well, yeah, sure, if you want to do that, she goes, he hadn't responded to some of her emails. So I said, okay, well, let me catch him. So I happened to see him walking in the hallway, and I stopped him and I said, sir. And then he's like, oh, hi, how are you? And I said, oh, I'm doing great. I said, I was wondering if we could get on your training schedule for a class for your providers. And he's like, oh, is this for all of pain? I was like, well, pain and physical medicine, that kind of thing. If we could get, a class going for them, just an evaluation and management class, a refresher, so this way they can ask questions if they need to. We can get with some of the providers and see if, what is the issue here, And he said, oh, yes, that would be fine. So within an hour, I got a call from his secretary, and she was just like, oh, yes, she gave me the available dates, that we could do these classes. And I said, okay, today, the second would be perfect, And this was a couple of months ago, so we knew a couple months ago that this was going to happen today. So and by the time it, like, the month just flies by, and then 2 months goes by and then it's already here. So I had talked to the other coder yesterday, and she was like, okay, do you want me to come over and help you print out anything or whatever? And I said, no, I got it. And I had already gotten all the packets together already. And that's something that is like very quick for me. I don't take a lot of time to do that. I just get everything printed, or if there's anything that needs to be laminated, I'll do that as well. So I did all of the packets, and I had gotten some bottles of water, and I had a little ice chest, and I put some ice in there and just let them cool down, because everybody was moving in the clinic, and so there was a lot of switching offices. It was moving day too, so there was a lot of meetings going on, and I knew they were going to be hot, by the time they got over my class, or our class, and so and sure enough they were. So they were late. Some of them were late, but it was because they were in another meeting. So they had to run from meeting to meeting, So by the time they got to me, they were just like, okay, we're here, we know, and we're sorry. And, it was fine. I understand, like those training days, anytime they have days where they're just doing all this, classes that they need to catch up on, or meetings or whatever, those days get very hectic. So, I just waited, and I just hung out with some of the other providers that were already there. And so we were talking and discussing these slides and everything. And it was nice that they were all very engaged today, it's really amazing. And they are a great group of providers. I mean, I've never had any issues with them. They've always been very, like I said, on target. And so, but just seeing some of the new faces and things was really good too, because they were just as engaged, And for a couple of them, this was their first class with me. And so it was nice though, because at the end of the class, one of the providers was like, would you come over? And I said, sure. So I went over and I was talking to her, and she, she's going to start doing injections and things like that. So I was like, okay, well, we need to work on, making sure that you have a good template, that you can work with, to make sure that you have all the information that you need documented, so that way when you're doing your injection, what questions to ask, or what to document, so everything is clear. Like, how much did they of medicines did they inject, or which side did they do, and that kind of thing. So she's very excited about it. I'm going to be working with one of the, he's like a systems administrator, and he does the sort of the templates. He works with the templates, and, I'm going to get him to come down and help them. So next week, we have a meeting with him, and I contacted him too, because he's another one that's just very quick about getting back to me, and which I'm really glad about. And because that administrator had seen me a few days ago, and he was like, oh, thank you so much for your help. And I was kind of confused, but I think what happened was he had got, one of the people that he was working with had gotten a copy of my slides that I had done on another class, and they were discussing those slides. So that was, I guess, how he was thanking me for that, for doing those slides. And so I was like, oh yeah, sure. Okay, that's not an issue, So he's going to be meeting with some of the providers next week, and that's good, because at least this way it'll set them up for success, and they'll know that they are supported, and the one provider in that class that is going to be hit first with this administrator is very grateful, because she was like, oh yes, I always forget, and I don't want to forget. I want to make sure that I'm doing what I'm supposed to do. And so, we're going to set that up and make that a possibility for her now, so that way she gets a little bit more support. And, when you have a high volume clinic, there's just like a lot of encounters that come in, and I know this coder gets swamped with a lot of encounters. So it all, again, it goes back to time delegation and, things like that. So if you're set up on a schedule, you can, get going. And as I said, there's some days when I do, very little. I feel like it's a little bit, but it's only because I'm doing something else. And then there are days when I can produce 150 encounters in a day, or I can do 160, and sometimes there's days that I do 120. Some days there's days I do 80, So it all averages out, and I average out over what I'm supposed to do anyway. So that's really good, because as I said in a few videos ago, we get paid very well as medical coders to do what we do. And in order to maximize, what they can get out of us, it is important to make sure that you are educating yourself and making sure that you are, trying as best as you can to learn everything that you can, to make sure that you are getting that provider everything that they're entitled to. And if something doesn't make sense to you, then of course ask, talk, communicate. Those are key things. And when I was in this class and I'm talking and everybody's engaged and listening, it is such a good and refreshing thing. I've been in more classes where they're like that than where they're not. It's very few times, it's rare, knock on wood, that happens where somebody just doesn't want to listen. So that the days like these invigorate me, of course, and and show me that this is why I love doing what I do. I really enjoy the teaching part. I enjoy the engagement of the providers. I really do. And I love seeing them go from really good to even better, and that's what I like. I like always improving and moving forward. So yeah, that was one of my favorite moments from today. So the other thing I wanted to talk about was, if you are not sure what credential to get, okay, I want you to think about this first before you start thinking about which credential you want to go towards, okay? If you're studying medical coding currently, okay, think about which setting you like to code in, okay? If you like coding for outpatient, or if you like coding for inpatient, or if you like coding for both, okay? If you like coding for both, there are credentials that you can get that cover both inpatient and outpatient. And or if you're just interested in coding only for the outpatient side of the house, there's credentials just solely for outpatient as well. I encourage you always to check out the two medical coding associations, the American Health Information Management Association website and the American Academy of Professional Coders. Now, I am a member of AHIMA, or the American Health Information Management Association. So that is where most of my knowledge is with them. I don't know a whole lot about AAPC. They have different credentials. A lot of them I would have to read and find out what it is that they actually are, what credential means what. But be sure to check out the website, check out AHIMA, and see, when you decide which setting you like to code in, right? Whether it's outpatient or inpatient or both. Think about this. You want to be able to ready yourself for the most diverse settings ever, okay? So if you want to really commit to medical coding and you want to be able to apply anywhere, think about really learning both outpatient and inpatient settings. This way you can work towards the credential that covers for both. So something to think about. I know it's confusing and it's a lot, so be sure to email me if you have any questions. I can, try to help you out and try to answer some of those other questions. It's sort of hard sometimes to know what to say, because it's like, you don't want to like repeat things or, make it sound like you're sounding like a broken record, which I try not to sound like a broken record. I try to change it up every now and again. So, but Anyway, but yes, try to decide that. I've always just been in the outpatient setting, so I've always said I need to go back and do a class for inpatient, so that way I can learn it. Because the rules for inpatient coding and the rules for outpatient coding are different. And so that's where some of the confusion lies. And I've always worked with the CPT book, and I haven't worked with the PCS book. I took the PCS class when we first switched over to ICD-10, but that was years ago now. So, and I didn't stay with it as much as I should have. So, again, you live and you learn. So, but yes, just some food for thought for today. And I will go ahead and close this video out so that I can shoot Quiz Friday for you guys. So I will be filming that here in just a few minutes, but I want to go ahead and send this up so that way you guys know that I didn't forget about you guys today. Good time, Charlie did not get me. And if you have any questions, just be sure to shoot me an email. I will include my email address down in the description box below. And I will see y'all again in a few minutes. Bye.